Good evening, everybody. Welcome to week 2 of Bike and Build's summer-long webinar speaker series. My name is Eric. I'm the program director with Bike and Build. And if you're unfamiliar with Bike and Build, usually during the summer, you can find us as we're biking around and across the country, pedaling for affordable housing. So we typically run trips for young adults to bike across the country and then advocate for and volunteer with affordable housing organizations. And so unfortunately this summer we had to cancel our trips due to coronavirus precautions, but we decided to host this speaker series to recreate some of the on-the-road engagement with affordable housing that our riders typically have. And affordable housing is a complex cause. It's about more than just a home. It's deeply intertwined with education, racial equity, public health, government lending, transportation, fair wages, zoning laws, and so much more. And so with this series, we're hoping to focus on those different aspects of affordable housing to talk about more than just, it's about more homes. And so this week, I'm very excited to introduce two speakers, Molly Rennie, the Director of Strategic Partnerships with the United for Alice Project, and Blair Schleicher Wilson, the CEO of Morris County Habitat for Humanity in New Jersey. So the two of them are going to be talking tonight about their work with the Alice Project, and we'll hear from them for about 30 minutes or so. And I encourage you to ask questions via the Q&A box as we're going, and then we'll also have a Q&A session at the end. But we're going to try to make this as interactive as possible, and so if either Blair or Molly ask a question to the audience, the chat will be disabled. And so you can use the raise hand function, and then I will turn your mic on and you can actually talk to us. So with that, I'm gonna hand it over to Molly and Blair.
Okay, well, let's see if I can get us going here. Can everybody hear me okay? Can you nod your head, Eric, if we're good? Okay, and you can see my screen. And somebody's already raised their hand. Okay, so thank you, Eric, very much for the kind introduction. And I would like to say that I'm so sorry that you all did not get a cross-country trip. We think it sounds so cool, and I want to do it. So, although I don't know that you would want me to do it, but it sounds great, and I do hope you get that opportunity someday. So Blair and I are going to split up this presentation for a couple different reasons. I am going to kind of set the table to try and give you some metrics and some perspectives from a data and a research point of view about financial hardship and some of the problems that contribute to housing issues. And then Blair is going to take it in a different direction and talk very much more specifically about housing. So I hope that you will be able to absorb some of what I'm trying to tell you here about this data and research and use it to kind of understand what some of the very serious challenges and barriers there are to housing for millions of Americans in our country. So that's kind of our strategy. And I think before I begin, I have to remember to tell everybody what ALICE stands for: Asset Limited, Income Constrained, Employed. And so it really describes millions and millions of Americans that are working really, really hard, mostly at low-wage jobs, and sometimes at more than one job, sometimes at 2 and 3 jobs, to try to make ends meet. And I'll go into a little bit about what that means in a minute. And it sets up, I think, nicely why we have such a problem in this country. So we wanted to quantify what it meant to be in financial distress without without using the term working poor, which is how we came up with ALICE. And ALICE isn't a man or a woman. Alice, in fact, in our data world is a unit of measure, which is our households. And so households come in many different sizes and shapes and colors and sizes, and that's part of how we try to describe this demographic. But we also really wanted to build a narrative around Alice. So Alice is a person, you know, it's not just our data and our research, although we have a ton of that. You know, Alice could be our mom or our dad or a sister or a friend or us, any one of us. People become Alice's, they slip in and out of Alice and into poverty. And they're the millions of hardworking Americans that are doing jobs that we really need. And they help keep our economy running. There are gas station attendants and deli workers and childcare workers and teachers and people that do janitors and all of the folks that are the essential workers during this pandemic in the hospitals. People that we really, really need, the subway drivers, truckers, grocery store workers. And so without them, you know, our economy just doesn't function properly. So we've always recognized that this was a really important demographic, and we wanted to understand a little bit more about it. And so by way of a little background, we started this project in Morris County in 2007, just before the Great Recession. And Morris County, for those of you who don't know, in New Jersey is one of the wealthiest counties in the country. And yet we were still seeing a large amount of financial distress, even though we had, before the recession hit really hard, we had a very low unemployment rate. And so we built this methodology. Our head researcher and economist, Dr. Stephanie Hoops, built a methodology that tried to, along with a research team that factored in lots of different things. And we came up with what's called the Alice threshold, or the bare minimum of what it takes to survive in a modern economy. And I'll show you what that is in a few minutes. So in any case, what we found was rather than 4% of the people that were really struggling to get by, we added another 24% in Morris County. So at the time, it ended up being a 28% of people that really literally were right on the edge. And since then, it's grown to 38%. This metric and this report and this narrative we built was so effective in New Jersey that through the United Way system, many, many other states in the country have picked it up and are using it too for their work. And that's how Blair got involved with it, because she uses it as a foundation for a lot of the work that she's doing as well, which she's going to tell you about. So that's a little bit of a background. You can see what our vision and our mission is. We really are striving to become a standard measure. And I should back up and say another reason that we did this is that the federal poverty level, which is a data point built in the 1970s, which is a multiple of a food budget and doesn't even change by the size of the family, is, as I think we all know, an entirely unfit measure to try and base government programs upon. So we've built this other metric that we think is a lot more solid, and it goes down to the county level. So it's not just one number. It's very locally oriented. So of course we would love to be the new metric for the government to use in all of their work. Not sure that's going to happen right away. We're having a lot of success with it being used by lots of different entities. So we conduct research and we write these reports, and we lead a learning community of which I consider you now to be a part of. And we try to inspire action. You know, this is all really great, but unless it's being used and unless it's being operationalized, it's not helpful. So this, as I said, it's more than a report and more than data. So I said a little earlier.
Can I jump in? Yeah. So you conduct research. How do y'all collect the data for Alice?
So it's a significant process, and over the years we've built up a huge database. And the data comes from largely all public sources. We rely heavily on the American Community Survey and the Bureau of Labor Statistics and HUD and those types of sources. And we have a list of those in the report that you can see. But we also, within a state, as we're building a report, we work with local data experts. And a lot of times childcare data is it's not a standard measure across the country, so we oftentimes need help with that. And we've actually built, I think, probably the best database on childcare in the country. And taxes sometimes have a lot of local variation. So in addition to our sources, we use statewide and local sources also to get as our data collection process. To answer that question. And if you have any other interest, you should go to our United for Alice website and you can see the whole methodology and view all of our sources for each state. So I mentioned before the Alice threshold. And the Alice threshold means the minimum budget for a household to get by with just the basic necessities. And you can see it's all listed here, kind of a standard budget. We didn't even used to include technology, but the research team decided after much discussion that a worker can't get by in a modern economy without a cell phone. So we added that. And you can see by this budget that these amounts are very small. And I don't know how you can live on the amount that we've allotted for each of the budget items. And that's we wanted this to be the bare bones, there are no clothes, no going out for dinner, nothing in here, no money for going on school trips or, participating in sports or anything. It's as low as you can go. And there are many other budgets and they're fine. MIT has one, Economic Policy Institute has one, Self-Sufficiency has one, and they're all higher than this Alice survival budget. So we recognize that we wanted to be the lowest one because we knew that it was going to be a number that people were really going to be surprised at. So this is in New Jersey, and this is the state average. And as I said, we have all of this information by county, and Pennsylvania participates in the project, so we have a Pennsylvania report as well. But $75,000 seems like a lot of money for a family to be able to get by on. But as you can see, it doesn't measure up. So this is sort of the definition of how we define an Alice household. And this is another way of looking at it. And we have, where am I going here with my mouse? Okay, here we go. So we've broken it down. Can you see, let me minimize this. Okay, there we go. So this is looking at a household budget in a different way. And we have broke out a couple of different types of households, an adult, a senior. We have a senior survival budget because that's a bit different than a family. And then we have a way you can create all sorts of different household configurations to see what those budgets would be like. And then you can see where the federal poverty line is. And actually we have in another presentation, we figured in the CARES Act as well. And so it doesn't even barely get to the level of what you need to get by. And of course, housing is always very high up there. Besides childcare, housing is the other most expensive part of a person's budget. So we know that it's very difficult for households to find a place to live, and you can see here why that is. So you can slice and dice this data for different kinds of households. And again, the senior budget is something that we added because that's always, it's different. Their needs are different and the like. And another interesting thing that we've done is I I think many of you have heard about the Alice Essentials Index is the CPI is the index that measures all of the goods and services that Americans use. So it's a huge basket of goods, and it measures inflation over time. And it's not really reflective of the challenges that Alice households are facing, because the goods and services they use are shown here on this budget. And those goods and services have increased in cost way faster than the other huge basket of goods. So I just mentioned that because it's another challenge. So the other thing that define Alice households are low wages. So in New Jersey, and this is very similar throughout the country, 51% of the jobs pay less than $20 an hour. And a large portion of those pay less than $15 an hour. So, we're in a landscape where no matter how hard you're working, you can't find jobs that pay enough to even sustain the basic survival budget. So it's a huge challenge, and it makes it really difficult for households to find housing or childcare or afford food. Unless they could get higher wage jobs. And then you can see here how there are fewer and fewer high wage jobs. So that's the other side. So there's the expense side, which is the survival budget. And then there is the low wage side, which is the income side of the Alice conundrum. So what all of this means in New Jersey, and the same is true in Pennsylvania and around the rest of the country, is that rather than a low poverty rate, really 38% of households are simply not getting by. And the ramifications of that are significant. And of course, with the pandemic, we know that it's going to be way, way, way worse when the dust we're able to collect the data on that, which are. And then we estimate that 10 or 15%, additional 10 or 15% more families are on the cusp. And the pandemic is likely going to drop them into the Alice threshold or below. So it's it's a tough picture even before the pandemic, and then the pandemic has really, of course, made it worse. I believe that it provides opportunities for reimagining certain things in our economy, but right now it's a difficult situation. So I think I tried to describe earlier that Alice's are everybody, and so we break it down by race and ethnicity, and this is an example of age groups, race and ethnicities in New Jersey, single male-headed and single female-headed, and the yellow is the above and the blue is below, and we're trying to illustrate that it's Alice is everywhere, but it disproportionately affects minorities, specifically Hispanics and Blacks. And at the moment with COVID and with our Black Lives Matter movement and the ripping off of the Band-Aid of the inequity in our world, in our country, we think that this data is very helpful in trying to understand that better. So this sort of gives you an idea of who's Alice and what demographic they fall into. So as I mentioned earlier.
On that last slide, can you go back for a second?
Sure.
There are two different categories: married with children and families with children. What's the difference there?
What's really interesting is that the way people live is really, really different. So you have like down got the single and cohabitating, so they would just be people. And then there are household configurations that have children, but they might not be married. And this information is all based on census information, so it's self-reported. So it's a family configuration that you would see in the census.
Thank you.
Sure. Anything else? Okay.
Yeah, we had one more question. This data here in this graph, is this just New Jersey, or is this?
This is just New Jersey. Yep.
Got it.
But as I said, if you go to the United for Alice website, you can get all sorts of different states, and there's so much to be looked at, and I encourage you to check it out if you're interested. And then, of course, all of this is not useful unless it amplifies the problem and helps create change. So I can say that in New Jersey, and I know it's true in many and all the other states that have done this work, that it has given us a platform and a voice in our state legislature, and we've been able to have some success around things like increasing the child care voucher so that Alice families can afford to go to child care. And we're being asked to participate in the reimagining the New Jersey economy as we work our way through the pandemic. And it's useful information for other organizations besides the nonprofit community. There's the academic institutions are interested in this, and so are our chambers, and our business communities are interested in this as well. So, from our point of view, I think it's, we've been able to use it for our advocacy and policy, but other organizations have been able to use it as well, which, this is for everybody to look at and help support the work that they're doing and the policy making and advocacy that they're doing. So I think when we're going to get into Blair's part of the presentation, she's going to be able to talk a lot. She's going to speak to that a lot more than I have. So I mentioned the pandemic, and of course it's an unprecedented situation that we're in, coupled with the ongoing protests, and the impacts it's on all of us. But it's particularly hard on the essential workers and children and families and seniors. And of course, the job landscape has completely changed and probably will never be the same again. And although I think it presents opportunities, the economic impact is really going to be significant. So we're working, trying to create some predictive modeling for how this is going to play out in the next few years. So if there's any interest, do more on that later. So before I stop talking, Eric, are there any other comments, or does everybody have a pretty good idea of who Alice is based on some of this information that I gave you?
There's nothing in the Q&A box, but I had a quick question, and it might be a little bit off topic, and Blair, you might touch on it too, but I'm wondering, you mentioned part of what you're doing with your Alice work is working with New Jersey for reimagining the economy. And so I'm curious just either what your work with Alice is, or what your personal hot take is about how we can reimagine the economy after COVID.
Yeah, so one of the things that we're involved in, because we have some experience in this, and I'll be interested to hear what Blair has to say, but one of the things that the governor has identified and knows, partly because he knows Alice, is that, even if the occasion arises that workers start going back to work and there are jobs for them to go back to, many of them simply won't be able to go because they won't have any childcare to take their children to, and or they won't feel safe. And so, because the childcare is very hard by this, because they operate on the margin in any case, and this has really impacted them very, very severely. So, with not just ourselves, but with many other experts in this area, human resource departments, childcare operators, local officials, and nonprofits, there is an effort to try and reimagine how childcare system can accommodate safely children, preschoolers, so that their parents can go back to work. So that's one example, and I imagine Blair has an example or two as well.
Thank you.
So,
oh, we have one more question.
Yeah.
It's a live one. So Vinny, if this doesn't work, let me know, but I'm going to turn Vinny's mic on so he can ask.
Okay.
All right, Vinny, you should be able to talk.
Great. Can you hear me all right?
Yeah.
Cool.
Yeah.
Thank you for sharing your knowledge with us, Molly. I noticed in one of your first infographics that I live in a state where there is no Alice report. You also mentioned that most of the data was coming from the Bureau of Labor Statistics and other census or sources that I imagine already exist.
Mm-hmm.
What steps are missing in the process for creating a report in North Carolina?
Mm-hmm. We'd love to do one there. So how we do this, and it can be done in lots of different ways, but first of all, it's expensive, as you can imagine. But we usually work through the United Way system, and a state association or a big, Leadership United Way will take the lead, and they will work with us to build a research advisory committee and other committees that help us do what we need to do to not only build the report and write the report and understand your state, but to also bring along local United Ways so that they know this is happening and they understand it so that they can use it. And then what happens over time is their use of it amplifies it, and usually in the nonprofit community and in the public sector, and it becomes very well known. So I know you all have a state association, but I don't know that I've had a lot of success attracting attention for this. I think sometimes states use other measures, but that's how we've been doing it.
Great, thank you. This may be a silly question, but could you speak more to what exactly the United Way is and what that organization, how they operate on a local level versus what the United Way is?
Yeah, so United Way has changed a lot over the years. There's an umbrella organization called United Way Worldwide, and then there are many local United Ways, about 1,100 local United Ways across the country. And traditionally, a United Way would raise lots of money from companies and corporations, and it was sort of a old school, go in, run these employee campaigns, payroll deduction, choose what agency you want to support, or just give it directly to us, and then we decide where we should direct the funds based on need. And that went on for many, many years. But as you know, times have changed, and you all are an example of it. That's not how people want to donate their money anymore. And they don't need United Way to do it for them, because they can do it so easily themselves, and they have access to so much information, and they understand, they have interests of their own. So we've developed what we call a community impact model over time. And we still raise money, but we raise it differently, and we raise less of it, generally speaking. But what we do is we try to build collaborations with other nonprofits, with public officials, and we focus our energies, our work, and our financial resources on whatever the most pressing problems are in a particular community. And so that can be really different across the country. Typically, that work would be in the education space, or the health space, or financial stability work. We do a lot of financial stability work, focusing on low-income people. And we have lots of volunteers. We need our volunteers. That's very, very important for us.
That definitely helps clear it up. So am I understanding correctly that United for Alice is an initiative of the United Way?
Mm-hmm. That's
Okay.
great. You got it. So United Way of Northern New Jersey, which is where I'm on staff along with the Alice Project team, is where the work originated, and it's become so useful in the United Way system that we've been able to grow the project, or the initiative, if you will, nationwide, and it's still growing. And many foundations have become very interested in it. And in fact, a foundation in Arkansas helped fund the report for Arkansas, because the United Way system down there does not have the capacity to do something like this. So it comes in different forms.
That's very helpful context. Thank you very much.
Sure. Okay, so this is where Blair is going to bring this alive for you.
Okay, well, thank you. Thanks, Molly.
Sure.
The Alice report, I've been with Mars Habitat since 2004. And when this came out, it gave us at our organization an opportunity to put a real face on the need in Morris County. So in 2004, people in Morris County, still one of the country's richest or wealthiest counties, would scratch their head and say, we don't have a need here. But our phones ring off the hook. We're here along with Interfaith Food Pantry and Family Promise and some of these other organizations, working with the folks in need. This report helped us put a face on the need, and it helped us to shape in our grant writing and in our messaging and marketing. I saw, and I think you need to write this in there, Molly, we incorporated this in our strategic plans.
Yeah.
We're going to talk to our investors, our supporters, and talk about the real person. So, once upon a time, you're saying, low income or workforce or, some other name, and that just, those names, that's somebody else. It's not here. We don't have that. So, when we started looking at, when United Way looked at the real people, here's some pictures. Repair technicians, bank tellers, Molly listed a whole bunch, food service personnel, and also people who are paying more than 50% of their income in rent, people who are living in unsafe and unhealthy housing conditions, folks living with friends and family. A lot of that goes on in our county. So we may not have tent cities per se, but we have a lot of people that double up. So this is a way for us to say, you know who Alice is. You already know Alice. These are, the people that people that you're going to your stores, maybe your own family members, maybe it's you. It's people that we come across on a daily basis. And so, sort of the impersonal words, asset limited, income constrained, employed, that's the data, folks. Sorry, Molly, but I'm in the people business and I've got to paint a picture. And so this is a way for us to demonstrate reality. These are folks that the picture with the family, with the little boy with the orange shirt, to my left, I guess maybe your left too. I don't know. But he's a maintenance worker at our county offices, and she was a child care worker, and they're living in public housing. I think the next slide I have an actual case Here's Irina, 2 kids. She earns $38,000 as a teacher's aide. The average rent for a 2-bedroom where she teaches in Morris County is $1,500 a month. Okay, so, just simple math will tell you that she's not able to afford that. She would have to make at least $60,000 a year to be able to afford the $1,500 a month rent. And that's the situation we're living in here. And it is made worse. I can tell you, our phone is ringing off the hook, despite the fact that our offices have been closed to the public. I think Molly might have said the average renter wage is like $18.68, something like that. That's certainly not gonna really cut it when you need over $28 an hour to be able to pay. So before I go any further, I just want to tell you a little bit about who we are. Because some of you may not know Habitat for Humanity, and maybe you could raise your hands. How many of know Habitat for Humanity? So I'll tell you a little bit about our vision, mission, and the work we do. So at Habitat International, Habitat for Humanity, like United Way, we have an umbrella organization. We're a federated organization, and we have around 1,100 affiliates throughout the United States, and we're in 70 countries. Our shared vision is a world where everyone has a decent place to live. It's a ginormous vision, but we truly believe that. And we were driven by this mission when we began in 1976 as a grassroots organization on a community farm in southern Georgia. And in that community farm, it was a demonstration project to demonstrate that whites and blacks can live together. And there, this idea of partnership housing was born. And so since then, Habitat for Humanity, of which Mars Habitat is an affiliate, has grown to be a leading global nonprofit working in local communities here and, like I said, in 40 or 70 countries around the world. Since our founding, we have helped more than 22 million people. That's we as a global organization. And in 2018, we helped nearly 9 million people gain that, and an additional 2.2 million that helped them to improve their living conditions through training and advocacy. People work with Habitat with a hand up to build or repair their homes. We use a volunteer model. We have an affordable mortgage that we eventually will sell the homes to the folks. And our program is a lifelong, long-lasting, sustainable, generational program. So it's working today to affect the lives down the road. So what are the current issues and how is Alice affected? And it's really, in one word, affordability, 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 3 times. These are the issues. Today, we're in a housing crisis, as you may know, and some of these issues have been borne out through the gentrification of inner city neighborhoods, where the affordable housing is disappearing. There's a lack of workforce housing to help people who are working in lower income jobs to be able to have a decent place to live. The nonprofit development capacity is an issue, declining public subsidies, and escalating land costs. So really what we're here today is to demonstrate how we work with Alice. 1 in 6 US households spend half or more of their income on housing. And this goes back to the affordability issue. And as I said, there's a housing crisis in the country. For the first time in, I think in a very long time, and I'm going to say almost in history, but that at least I can remember, that presidential candidates are now talking about affordable housing. What are we going to do about it? There are 10 cities growing around the country, especially in the warmer climates. Families are struggling to make ends meet, people living in cars. My daughter owns an RV park out in Arizona. People are buying small RVs, living in an RV parks, which basically is like a motel, if you will. It's it's a temporary housing because they have no place to live. Over 39 million households in the United States can't afford a place to live. And so now people have to choose. You've got your home costs, which Molly was showing you. It's a large part of one's budget. So what do you choose? Is it your healthcare? Is it education, nutrition, transportation? We find this unacceptable. And the ALICE population is stressed. So if this is your childcare worker and she can't or he can't make ends meet, what kind of care are they giving to your child? And I think it's something that dialogue now is going to be opened up. I think it already is. I think we're starting to talk about this crisis that we find is unacceptable, that people should not be paying anywhere near half their paycheck in a rent. The definition of affordable housing is that you pay 30% or less of your income on affordable homes. So what does it help? And we talk to legislators and our local elected officials, and they say, well, why should we care? We've got enough, especially in Mount Morris County. The average income is pretty high. Why? What does affordable housing do for us? Well, it improves the quality of life for families, and that by design will improve the quality of life for everyone. Money that is spent in affordable housing goes back into our communities, especially as what we're going to see in the next slide with a housing continuum I'm going to briefly talk with you about. Then there's a reduced stress on the home market. This is important because if people can't find an affordable place to live, we can't move people up this housing continuum. So here's a slide. The next slide is exactly that, the housing continuum. And when we talk about ALICE and where do they live, they're living down over here on the left side in social housing. Typically, this is housing that is subsidized by government subsidies, or nonprofits have built. It's your homeless shelters, it's your transitional housing, your public housing. As we move up, maybe the subsidies are decreasing, but nevertheless, they are. These are folks that are in crisis and they don't have a permanent residence. And I will tell you that public housing was not designed to be a permanent residence. It was designed as a safety net to move people up. But the unfortunate thing is there's nothing for them to move up to, so they stay generational. A program like Habitat, we believe that affordable home ownership is one way to help move people up that housing continuum. And we and other similar nonprofits building for home ownership, where we are freeing up, we'll build the affordable homes, we have affordable mortgages, where people now have a piece of the American pie, people that they moved up the housing continuum, maybe from transitional housing or public housing, or even expensive rental housing into affordable home ownership. So many good things happen. You're now freeing up space to allow families to move into those homes. So we feel like we're actually helping two families. So we measure sustainability about the way, how long a tenant is ideally living within a space. And so at the beginning of this continuum, the stay should be short, compared with somebody moving up to, say, high-end rental, affordable home ownership, or market rate ownership. And then, of course, affordability is the second way to measure this housing continuum. Let's see. So, here we go. We feel like we have what's happening now in this housing crisis, it's a broken housing continuum, because our whole population, you and me, we depend on a housing market that you can move into. And I know even first-time home buyers, you know, two people with incomes trying to find a starter home or a home that you can afford is very, you know, it's very difficult, because if people aren't moving, you can't get in. So it's an overtaxed rental market. We need, you know, pathways. And so right now we feel there's no pathway to move people up this continuum. So unless we find a way, unless we start developing some policies, our rental market will be overworked, underfunded, and unable to meet the demands. And the demand is really, it's growing. Yes?
You said we currently don't have those pathways. What could those pathways look like?
Well, the first one, in my opinion, is that we need to expand rental subsidies so that people that are in market rate rental can pay an affordable rent. And then we have to expand the building of affordable rentals. And I think now in this climate, and I read somewhere recently that we've just compressed 10 years of bringing ourselves into the 21st century in 5 months. Well, that means that what we're finding, that many corporations are reevaluating whether, you know, and whether or how many employees are going to come back to work. That might mean that there's going to be empty buildings. We already see that in Morris County. Lots of empty buildings. How can we reuse those buildings? What other ways can we use them? Maybe some public subsidies to help us reimagine those spaces. And you know, maybe there's some incorporated, you talk about childcare, and you know, maybe go and look at some other countries and how they have shared childcare. It's not dropping your kids off at a center, but there's mechanisms where people take turns and watch each other's kids with their employers, you know, A-OK. So if we do that, those are some ways. Rental, you know, increase rental subsidies, and we actually have to put new building in the market.
Cool, thank you.
And I do want to point out two things, that these historic and enduring shortages that we're seeing, and they've been growing. I can tell you, in my tenure, we've seen it. You know, but we thought we were loud voices, but today we have seen it in the last 3 years. The economic downturn really started to shine a light on the housing issues. This has majorly increased of course, our housing costs and the rates of homelessness. It also created a catastrophic collapse of homeownership for African Americans. And we need to address those two issues. You know, we talked about affordability and building more homes, but the other is to work on bringing up the rate of home ownership to African Americans, and Habitat and others. And I can tell you, some of our legislators were getting on board, talking about developing a housing policy that will be fair and work for the entire population. This is not just affordable housing, affects everyone. I used to serve on a town council. One of my colleagues said, "Oh, Blair, who qualifies for affordable housing?" And he had just finished telling me that his daughter graduated from name brand college, and she works at a museum, and it was nonprofit, and she wasn't making very much money. And I said, "You know, the story you told me about your daughter, guess what? She qualifies for affordable housing." And he was shocked, because he didn't realize that it just had no idea, because she was living at home, and you know, that was fine for a 23 or 24-year-old. But as we go on, it's just not good and healthy for our society, our communities. So some of the solutions on the next slide and I think, you know, this might also help address your question, Eric. Developing innovative financing programs, especially for programs like Habitat. Right now, we hold a 0 interest mortgage. Some of my colleagues are looking at different models where we can keep that mortgage affordable, but how do we incorporate, you know, a different financing model? Provide transit options to lessen cost burdens. That's another big issue, especially in the rural areas and suburbs. Major support for public and private nonprofit housing developers so that we can produce. I can tell you in our organization, I have 33 units right now, shovel ready, ready to go, that I'm going to be bringing to market over the next year. I need money to do that. And they are part of 120 units that I have planned down the road. I can't do that unless there's funding. And then create different housing choices. There's no one size fits all. And reduce the negative impacts of gentrification. There's positives for that, but then there's a real negative for it. You know, we're destroying these communities where there's culture and you know, people have lived there for generations. How do we mix the two? And then create programs that reduce displacement inclusion. And that's kind of going along with the negative impacts of gentrification. So at Habitat, we kicked off last year a 5-year advocacy campaign called Cost of Home. And we are now celebrating our 1-year anniversary, where we want to promote and increase the home affordability for 10 million people. And we want to do that by influencing policies and systems that will improve and promote our supply and preservation. And in the next slide, you'll see very simply, we're selecting 4 areas, and we're working with other nonprofits all along that housing continuum. It's not just about home ownership, because I'll tell you, we are finding in some of our affiliates that they can build, but they don't have a supply of ready homeowners, just because of, you know, there's other dynamics that go into that. So supply and preservation, land use, zoning. I can tell you in Morris County, in New Jersey, that's a huge, costly issue. Access to credit. We want to bring a more equal access to credit for folks, and then develop communities of opportunity. And we're doing this from the bottom up, top down. So encouraging Habitat affiliates and others. So working together in local communities to advocate for whatever's in your community. I was part of a New Jersey Together advocacy action oriented group where we found, and this is like micro, but it's this part of this policy platform where when the schools shut down, even though they were shut down for COVID, we had to, the schools shut down still had a spring break. This particular school system had a fairly large federal lunch program, but when they shut down for the school lunch program, for spring break, they shut down the school lunch program, which caused a big issue. When we found out through problem-solving techniques that the big issues were due to contract staffing, and they had staffing couldn't participate, and they had no place to store the food, we were able to fill that bill and have the schools reopen. And, you know, so it was all about finding the issue, advocating. So it doesn't have to be a long, drawn out, you know, lobby your senator or congressman. It's finding those local communities, those local issues in your communities, and working with people and to get that action done. And from that, we're going to grow and I think, you know, be able to demonstrate to our local Congress people, our senators, to shape a new housing policy. And I'll just say one other thing. We have done, and along with United Way, you know, we do studies, you know, in our global organization, that housing policy is also a health policy. And a doctor recently coined the term healthy housing is a vaccine. And, you know, along with this, so with housing, it's not just affordability, it's safe and it's decent and it's healthy. And what we've seen in this pandemic is that the folks that are coming to us, they're doubling up, tripling up. They have no way to really safely shelter in place. We've seen an uptick in domestic violence and child abuse, and you know, in our county, in our state, and I believe nationwide, because of these conditions. So you know, you and I might go home, we might have, you know, 1,000 square feet to live in, even 900 square feet, one person, maybe two. But when you're starting to put 5, 6 people in a place like that, it's taxing. So we're advocating for, you know, more units, more affordability, better housing policies, and to use this pandemic as the opportunity to shine the light on what's happening and what's happening that is growing. That if this ever were to happen again, we want to make sure that people are, you know, safe and decent and healthy. And so that's just a little bit about what we do. I mean, Alice helps us to shape the program. I want to thank you all for joining and listening and hearing, and I hope that you'll take action when, you know, maybe your local Habitat affiliate or others in your community ask you to think about helping to shape policy, whether it's locally or nationally, that you'll take action and use this health crisis as a strategy so that we can, you know, prevent future pandemics, and by alleviating the overcrowding and homelessness and addressing unsafe conditions. Draw lessons from what's going on today and for a better place to live for everyone. So thank you.
Great. Well, thank you so much, Blair. It's really neat to see what y'all are doing in your particular Habitat affiliate. It's cool to see the collaboration between Alice and your Habitat affiliate too. So thank both of you so much for coming and talking to us tonight. Just a reminder, we will be sending a survey out to everybody who attended this talk tonight to help us grow this series as we go through the summer. And if you enjoyed what you saw this evening, Casey's going to drop a few donation links into the chat box for the Alice Project and Morris County Habitat for Humanity and Bike and Build. And so if you like what you see and feel inclined to make a donation, please do. But if not, we welcome you again. Thank you, Molly and Blair.
Thank you.
We'll see you next week with our next speaker.
Thanks, Eric. Thanks, everybody. Have a good evening.
Yeah, good night, everybody.
Right.
Bye-bye.